wanted to take a moment to talk about this moment of urgent struggle and of opportunity. People in power are securing material, social, and political benefits for the few by promoting white supremacy and chaos. They believe life is a zero-sum struggle between themselves and others based on race, color, ethnicity, gender, language, religion, refugee and immigration status, income, ability, and political thought. In other words, all the rest of us. The zero-sum idea is a divide-and-conquer strategy that has been essential to the creation and protection of vast inequality. It is a lie that serves the few at the top. Among all the rest of us, it is a dangerous and poisonous belief that one group's progress threatens another's. It is used to demean and dehumanize, to rank humans in terms of their perceived worth. Zero-sum thinking can lead to resistance to universal health care if it is seen as benefiting some to the detriment of others. Instead of putting the blame for today's broken health care delivery where it belongs, on big corporations and the billionaire class, the Trump administration has divisively blamed others. Those who profit from health care have built a convoluted maze between patients and providers, acting as thugs by demanding ever-increasing ransom for our care. Our taxes are a foundation for health industry profiteering, including the ACA and Medicare Advantage. The extremely wealthy are concentrating ownership and getting richer from both our tax and personal health care dollars. Our leaders are not standing up for us when they serve corporate interests against us. Republicans, Democrats, and our institutions have failed us. Many Dems, present company excluded. Representative McCormick is the best. But many Democrats, because they are not in positions of power, say there's nothing they can do. Well, they can put the interests of people ahead of corporate interests. They can protest. They can challenge. They can demand different policies and visions. They can lead. But they, for the most part, do not. It is up to the rest of us. The serious fight for universal health care has been waged since at least FDR's For Freedom speech. That's a third of the life of this country. And it has been waged for more than half the time since our country's new birth out of the Civil War, with the guarantees of equality, due process, and equal protection. But health reforms throughout this long history have been torn apart by the health industry rapaciously taking for themselves. We must take this opportunity, where tyranny and corruption have been laid bare and our common humanity is made clear, to transform the status quo. It is not a zero-sum game. We do not have scarcity, we have greed. We can prevent greed in healthcare by advancing a system that values each of us. In contradiction to zero-sum, single-payer works because we all pool our healthcare dollars together to all share in the risks of disease and injury. Single-payer is the most efficient, most cost-effective, most humane way to pay for healthcare with financial security. The urgency of this moment presents us with opportunity. We don't have time for more reforms that will only be compromised by greed. We must unite across our differences. We cannot be satisfied with protest, with repelling each attack. The question is how to transform our outrage into our vision, lifting those left behind so that everyone rises. The rest of us can take this moment to reverse the cruel dehumanization prevalent among those in power, to focus on a democracy and an economy that recognizes every person's human dignity. In each of the struggles before us today, human dignity is paramount. After the Civil War, President Lincoln stated that it was up to the living, to us, to dedicate ourselves to the unfinished work of freedom and equality. In our America, the rest of us can stand together, not just in defiance, but with confidence, to advance justice, political and economic democracy, social equity, and human dignity. Bill?